Well, this presentation will focus on the problem of arrhythmia recurrence after ablation of atrial fibrillation. And I think to put this in perspective, when we first started doing ablation procedures, it was primarily for Wolff-Parkinson-White syndrome or AV nodal reentry. And generally when you did these ablations, you patted the patient on the back and you said, "Call me if you have any problems." And you almost never got called because they almost never had any problems. But as we entered into the era of ablating atrial fibrillation, it became a humbling experience. And some of the initial reports that came out turned out they weren't as accurate as people thought they would be. And it had to do with trial designs not being standardized, how patients were selected as to whether they had paroxysmal versus persistent atrial fibrillation, or other significant variables such as age or underlying heart disease, morbid obesity, which is a big problem in the United States, obstructive sleep apnea that wasn't treated correctly, or left atrial size, among other things. And then it has to do with the definitions of success. Some of the early long-term results tend to be pretty good. Focusing on the first month after the procedure, the long-term outcome, if you had it in the first month, is in the long term, about 44% of those patients had recurrences. And you can see that if the recurrences are extending into the second or third month, then the late recurrences rise from 69. Procedures, and that does include that does improve the long-term outcomes of these patients. Mayo Clinic has published their data. They also found that the elimination of atrial fibrillation was about 71% at 2 years, lower for persistence, and higher rates of recurrent arrhythmias in patients with persistent atrial fibrillation. And this shows the timing on the left-hand panel overall, and also showing the difference on the right-hand panel for patients with persistent as opposed to paroxysmal atrial fibrillation. Ed Gerstenfeld, who's at Penn, published their data. Again, you see similar trends, looking at a rate of late recurrence of about 7% per year after what they thought was a cure for atrial fibrillation. The same thing is true for the cryoablation techniques. Companies that make the cryoballoon will try to convince you that it holds up better over the long term, but I'm not so convinced of that. And they also find differences in recurrence rates over time. Now, we looked at our data, as I mentioned. We took, I think it was 2004, 2005. We do about 800 of these a year, and we took 831 patients. 69% had paroxysmal atrial fibrillation, 31% persistent. Median follow-up was 55 months. The recurrence rate in the first year was 24%, and the late recurrence rate, so these are the people who were doing well after 12 months, was 8.9% overall with a mean follow-up of 55 months. And this shows the early recurrences after a single ablation in the left upper hand panel. The left lower panel shows late recurrences in patients who didn't have any early recurrences, and it's fairly low, but still there are those recurrences. The upper right hand panel shows all recurrences both early and late, and the lower right hand panel shows all recurrences after the last ablation procedure. So certainly there is a benefit to patients, but it doesn't necessarily come with a single ablation procedure. And when we looked at these outcomes for patients with early recurrences, 81% underwent repeat ablations, and all of them showed recovery of one or more pulmonary veins for all the reasons that were brought forth in the prior discussion. 79% remained free of arrhythmias after the second ablation. 21% had recurrence after the second ablation. And some of these underwent a third ablation, others were controlled by medicines, and there were a few that just were difficult to control. When we looked at recurrences in the first year or late recurrences, you can see for paroxysmal atrial fibrillation, recurrence in the first year was 19%, 7.8% for late recurrences. Persistence was 35% and 11.3%. The risk factors for late recurrences were older age, non-paroxysmal atrial fibrillation, and left atrial size. Now, we have since done analysis of other types of heart disease associated with atrial fibrillation, and I can tell you that the cure rates for hypertrophic cardiomyopathy are lower. We've also looked at ablation procedures in people who have mechanical mitral valves, and both of those are lower. They run more like in the range of 45 to 50% for success rates. The types of recurrent arrhythmias, early recurrences and late recurrences, most often are atrial fibrillation, but we also see atrial flutters and some atrial tachycardias. And when you look across the country at what determines how much flutter you get, it does depend on how the ablation procedure is done. So the more extensive the ablation is, the more linear the lines tend to be, the more likely there are going to be gaps in the lines. Those are the patients who tend to develop atrial flutter. The observations from repeat ablations in all these patients was the recovery of pulmonary veins. The long-term efficacy when we put all this together was 79% free of atrial fibrillation without drugs, another 11% free of atrial fibrillation with drugs, and 5% just refractory atrial fibrillation that we couldn't control. Now, earlier today we heard some discussion about does early intervention make a difference, and it's something that we're currently looking at, and we decided to focus on people with persistent atrial fibrillation. So we took 767 of those ablations. They were all first-time ablations. The median time to ablation from the diagnosis to the time we did the ablation was 5 years. And we analyzed the diagnosis to ablation time based on quintiles, and the timing of ablation had a significant impact on both univariate and multivariate Cox analysis. This shows what happens to the left atrial dimension over time. If you don't do anything, it gradually increases in size. And then when you look at arrhythmia-free survival after one ablation procedure, the red line up at the top represents the first quintile, so these are the patients who had the procedures done earlier in the course of their disease, and the others follow, and you can see that the success rate is lower. And this is arrhythmia-free survival after one or more ablation procedures, so these include the patients we went back and redid. And you can still see that the outcomes tend to be better in patients who had their ablation performed earlier rather than later. So in putting all this together, I think it's clear that atrial fibrillation ablation alleviates symptoms in the majority of patients. Putting it somewhat philosophically, let's say you had a patient who had long-standing persistent atrial fibrillation, they were miserable with it, they went through an ablation procedure, and they had 1 or 2 recurrences that were 20 minutes long over the course of a year. By our definition, that's a failure. But is it really a failure? Well, when you talk to the patients, a lot of times they're very grateful that you reduce the burden of atrial fibrillation by that much. So it depends on definitions. Late recurrences are more common than initially reported. The cure rates are lower than initially reported, but still remain acceptable. And early intervention may improve the long-term outcomes in patients with persistent atrial fibrillation. Thank you.